Oh, please don't mind me. I'm just wearing my white coat around my apartment. Well, so originally I was supposed to get this a lot earlier, and my program gives 2 white coats, but I couldn't wear them because the original size that they ordered was a size bigger. So I had no white coat for the past 2 months. But now, yeah, I'm so glad that I got a size smaller, because then I still think it's a little bit big, but I can work with this. Anyways, I just wanted to share a little bit of my life with you before I get started, but I think I'm gonna take this off. I think it's a little bit too pretentious to wear it at home, and a little bit too hot also. But thank you for coming. This is Dr. Yu. I'm a firm believer that healthcare knowledge should be easily accessible to public, and I just like talking about weight management, and that's why I'm here. So today's topic is menstrual cycle and weight management. Have you ever wondered why you gain so much weight and you just crave so many bad food right before your period? Well, look no further. I have an answer for you, and I am a victim of this too. I hate my period. Right before it starts, I just eat everything and anything. So in order to explain that, let me just first talk about how we women go through a period. Periods are divided into follicular phase, which is the start of your period until the ovulation. And ovulation till another start of your period is called luteal phase. And it's during that late luteal phase that we crave a lot. So let's talk about hormone, as I'll simplify it. So hormone, as you can see a chart here, let's first attack estrogen. Estrogen is a woman's hormone that we commonly know of, and estrogen is known to suppress appetite. So when estrogen is high, it suppresses our appetite, stating, oh, I feel fine, I'm not hungry. But I don't want you to go out there and start buying estrogen pill, because that's not gonna help. It's not estrogen alone that causes this. And progesterone. So progesterone is known to be a culprit to make you feel hungry. So we typically give this to HIV/AIDS patients who lose a lot of weight. These patients will tend to want more food after they take this progesterone, so we prescribe it to them. And this is a reason why an individual who practice contraception through progesterone pill alone could gain weight. So let's talk about the reason why we crave so much bad food during this period. Well, so I did say that estrogen causes you to suppress appetite. So towards the end of your luteal phase, you're gonna have decreased estrogen level. And the hormone that suppresses your hunger all of a sudden decrease. Can you imagine what would happen? Yes, you're gonna have more appetite. And progesterone, the known culprit to make you feel hungry, that also increases during your luteal phase. This combination is not good. This is a reason why there is an emergency Oreo in my cabinet right there. Okay, so it's probably not the hormone alone. You might have noticed that even if you eat the same amount of calories, same amount of food, you still have water retention, and you might have that gas in your intestine. I've been there too. So we don't know the exact reason why. It might be because of the hormone, it might be because of some electrolyte imbalance. Some research does suggest that magnesium is a culprit, but again, this research goes back and forth. It's been going back and forth for the past 25, 30 years. One day they're like, it is the magnesium. The other day they're like, no, it's not the magnesium. But one thing we know for sure is that right before our period, that's when our cell have decreased magnesium levels. So there are some studies out there saying that magnesium pill during the luteal phase could potentially help you feel less bloated. So it might be true, but at the same time, no hard science out there. So it's not the definite fact. Another school of thought that says it's the calcium. It's a calcium dysregulation that causes this. Did you know that up until early 2000, they gave out calcium carbonate as a treatment for your PMS? Anyway, so there is a calcium dysregulation, but we still don't know if it's the calcium that causes this water retention and your bloatingness and due to your gas in your intestine. We still don't know yet. And another fun fact, well, number one culprit food that women crave right before their period is chocolate. if you're a guy out there listening to this, it's chocolate. So if you want to impress your woman right before her period or when she's feeling cranky, show up with a chocolate and I swear you'll have her heart. It doesn't need to be Valentine's. It can be any time. Just show up with a chocolate. I'm pretty sure she'll love you forever. So I just wanted to share a little bit of my anecdotal dieting experience with everyone. And this experience goes way back when, before I was in med school, like early 20s. And even now I still unconsciously do it, but I try to do my diet around my menstrual cycle. So during the follicular phase and early luteal phase, I try to restrict as much as possible, but enough nutritious and caloric intake, not like severe. So I think I maybe get like 1,400 calories a day during that time period. And towards the luteal phase, I allow myself to eat whatever and however I want. And I think instead of doing that 6-day like diet and 1 cheat day, I think that works so much better in my advantage, I think, because I just crave so much food during that period of time. I just can't do the cheat day during the week. Anyways, I had so much fun preparing for this just because I was able to apply my own personal experience as well as to read some medical background behind this reason. Please leave a comment if you ever practice what I practice, because I don't want to feel alone. I want to hear about your side of the story. Not a quote of the day, but a thought of the day. In the end of the day, it is the hormones that does dictate your craving as well as your body figure. However, we have to remember it is the food that also dictates our hormone.